Zimbabwe has agreed to compensate white farmers whose land was expropriated by former President Robert Mugabe to resettle indigenous families.
Zimbabwean President EmmersonMnangagwa says the land reform is of fundamental importance to the country.
Our land reform program remains a fundamental cog to our independence and sovereignty.
Hello, I'm Mubarak Kenya, and welcome to this week's edition of Africa Today, which will focus on the decision by the Zimbabwean government to compensate white farmers. We are asking, what's the reason behind this move? And is it a betrayal to indigenous Zimbabweans?
Hello, I am Sheila Nelima. In the second part of our program, we shall be highlighting on efforts to combat the COVID-19 pandemic in Africa after the number of infections exceeded 1 million cases last August.
And don't miss our weekly update on interesting news items from across Africa. Later in our show, we shall also peruse our social media pages for your comments on our previous shows and other current affairs topics.
Thanks for joining us, and stay tuned till the end of Africa Today.
Zimbabwe land reforms. Zimbabwe launched controversial land reforms in the year 2000 when ruling ZANU-PF party activists and veterans of the 1970s liberation seized large swaths of farms. The then President Robert Mugabe said retaking land from white farmers was a way to correct historical wrongs, since the land occupied by whites was forcibly taken from the nation's blacks during the colonial era.
We cannot continue to exist here, to live as if we are an extension of the British Empire or an extension of Britain or England. We are Zimbabweans, fully independent. We get our instructions not from London, not from Downing Street, directly from our people and from nobody else.
Mugabe, who died in September last year, aged 95, was ousted in 2017 after 37 years in power.
Now, the Zimbabwean government has agreed to pay $3.5 billion in compensation to white farmers whose land was taken during Mugabe's rule.
President EmmersonMnangagwa described the agreement as historic, saying it would bring closure to an emotive issue.
During his Independence Day address, Zimbabwean President EmmersonMnangagwa said land reform process remained an important factor in the country.
Our land reform program remains a fundamental cog to our independence and sovereignty. The land shall forever remain united with the people, and the people to their land. To this, there is no wavering or going back. However, we shall not shy away from fine-tuning our strategies to enhance land utilization, equitable access and productivity.
Now, to discuss this issue, we are joined by Lloyd Msipa, Zimbabwean writer and analyst. Thanks a lot for your time, Mr. Msipa. Welcome to our program. Now, what has pushed the Zimbabwean government to compensate white farmers?
Well, you got to look at this in context of, in terms of history, what happened in the past. Remember, after Lancaster, the British and the Carter administration were the underwriters of the payment of the land, which was going to be taken on a willing seller, willing buyer basis. And after that, obviously, Mugabe regime undertook the land reform, which put them in a bad position with the international community. It had a knock-on effect on Zimbabwe's economy, and the rest is history. So, bringing it up to speed to today, the idea of compensating the white farmers is premised on trying to improve relations with the international community. It is premised on Zimbabwe re-engaging with the rest of the world.
While Zimbabwe has agreed to pay white farmers $3.5 billion, the country is cash-strapped and is seeking international assistance to fund the compensation. This southern African nation plans to issue long-term bonds and jointly approach international donors with the farmers to raise the required funds. Addressing an Africa Development Bank session, the Zimbabwe Finance Minister Mthuli Nobe elaborated on efforts to raise funds for compensating white farmers. Will the government be able to fund this massive compensation amid the economic crisis?
If you look at that agreement that they had with the farmers in Harare, it doesn't say where the money is. It's clear they don't have the money. But what they're saying is they and the white farmers, the government and the white farmers, are going to go on a fundraising mission internationally, relying on goodwill, if I may say, that, the rest of the world will look at it and say, okay, let's pay money to the Zimbabwe government so that they can compensate these white farmers. That is exactly what the problem is with this agreement. It doesn't say where the money is coming from. The government itself doesn't have money. There are rumors that they will try and raise the money internally, by issuing out treasury bills and so on. But in an economy that is comatose, one wonders how they wish to proceed with that.
Western countries and international lenders have insisted that Zimbabwe must compensate white farmers whose land was retaken if it wants loans to revive its economy.
Speaking at the World Economic Forum for Africa last year in Cape Town, South Africa, President Mnangagwa said his administration is keen to chart a new path and re-engage the international community.
This is what he had to say.
In Zimbabwe, we've opened up. For the last 20 years or so, Zimbabwe was isolated. It was a pariah state. That we have opened. We have said we are going to engage and re-engage. Engage with those countries that had not engaged with Zimbabwe before.
Now our question is, will compensating white farmers and re-engagement with the international lenders end Zimbabwe's economic crisis?
Zimbabwe's economic crisis is not centered on the land issue anymore. It has moved away from that. The politics is the elephant in the room because we cannot solve the issues of health. We cannot solve the issues of the economy. We cannot solve the issues of bringing Zimbabwe back to the international community without Zimbabweans themselves agreeing on the political fundamentals. Because right now the politics is where our major dispute is. You are aware of the last election, which was disputed. You are aware of the fact that Zimbabweans had to go to court, and all the issues that are happening now, the problems we're getting today, is premised on the fact that there is no confidence in the current administration.
Thanks for that, and stay tuned for more.
Many have criticized the government's move, saying the country cannot afford to compensate the former white farmers. The government is being urged to prioritize funding for other sectors, especially healthcare. Zimbabwean nurses and doctors recently went on strike in the country amid the COVID-19 pandemic, demanding better pay.
So that they can be in a position to pay school fees for their children, and they can pay rents, because most of the landlords in Zimbabwe, they are charging US dollars, but the government is paying us RTGS or bond money, which is useless and worthless.
Is compensating white Zimbabwean farmers a priority now that the country needs to improve education and healthcare?
It is not an urgent issue. It is a problem we've had for 40 years. So why would you want to prioritize it now? There are other high priority issues that Zimbabwe needs to be dealing with. Most importantly, the country's leaders should be looking at uniting the people of Zimbabwe. Because as things stand now, we are moving from one election to the other. Zimbabwe is in a constant election mode, whilst actually we should be dealing with the economic fundamentals. So it is not the time to be dealing with these compensation issues.
The decision by the Mnangagwa administration to compensate white farmers has also come under sharp criticism inside and outside the country. Critics have termed the move as betrayal to the ultimate price paid by freedom fighters. A renowned Pan-Africanist, PLO Lumumba, says the compensation is unfair and unjust.
Who will compensate the former slave? Who will compensate those who are formerly colonized? It defeats logic. It defeats reason. Is it not true that they have compensated themselves through the profit that they have earned over the years? Are you now telling our kith and kin in Namibia and South Africa that they too will be asked to compensate those who have oppressed them over the years?
In this segment of our program, we'll be presenting you with news and events from across Africa. Now, a lot has happened apart from politics in Africa, so we'll see what our colleague has prepared for us today.
Thank you, Henia. This week, we report on progress in the continent. Now, on to an achievement. Africa was certified free of wild polio. The milestone comes after a decades-long campaign against the disease. Vaccination of vulnerable children is still ongoing. Health professionals and scientists continue to encourage people to spread facts about the vaccine, as misinformation has led to deadly consequences. Now, the Nile Dam talks were wrapped up. The irrigation ministers of Ethiopia, Egypt, and Sudan stated that the discussions concluded on a disagreement over the legal and technical issues. Every party is to submit letters of contention to South African president, including a vision on the next phase of the discussions. Now, another win for Africa. Dr. Akinwumi Adesina was again voted in as the president of the African Development Bank. The doctor was cleared of all charges, subject to the inquiry over a number of allegations in the bank. His administration has assisted many African countries with financial aid to achieve development, especially in the field of agriculture. Now, on to the corruption menace. The World Health Organization Director General Dr. Tedros Adhanom has strongly condemned corruption in the purchase of COVID-19 personal protective equipment. He termed it unacceptable and likened it to murder. His statement came after investigations exposed alleged graft in the procurement of COVID-19 supplies in Kenya and South Africa. Now, the first ever African virtual cartoon festival on COVID-19 came to a close. The festival was organized by the Embassy of Iran in Kenya, seeking artwork from cartoonists from Africa and Iran on the effects of COVID-19 in the society. Iranian ambassador to Kenya, Dr. Jafar Barmaki, awarded the cartoon animators including Mansoureh Degani from Iran and Alphonse Okech from Kenya. Now, last but not least, we cannot talk of the beauties of Africa and fail to mention another Kenyan special, the migration of the humpback whale. Every year around June to August, whales and dolphins make their journey from the Antarctica to breed and give birth in the East African coast, a 4,000-kilometer journey. Now let's see how they go.
Asante! Nice, nice! Kitu kimeingia sasa sarani. Hicho hicho. Wewe, unaona kazi hiyo? Kitu kimeingia sasa mwanangu.
A lot of excitement right there. Well, we have come to the end of this part. Visit our social media pages for news and updates on our episodes. Do stay tuned. We will be back soon.
COVID-19 crisis in Africa.
African countries continue to engage in efforts to combat the COVID-19 pandemic after the number of infections across the continent exceeded 1 million cases last August.
Now, as infections increased, the Africa Centers for Disease Control and Prevention issued a passionate appeal seeking contributions from Africans to eradicate the pandemic that is ravaging fragile health systems across the continent.
Fellow Africans, as you are aware, we are confronted with an unprecedented pandemic caused by the COVID-19. We are at a war, and a war that we must win to survive. And we can win this collectively if we contribute a little bit of change so that we can change the situation.
For more on how Africa is dealing with the COVID-19 crisis, we contacted Dr. Mary Stephen, the Technical Officer at the World Health Organization Regional Office for Africa. Thanks a lot for your time, Dr. Stephen. Over 1 million people in Africa have been infected by the COVID-19 virus, and the numbers are increasing. Is the worst yet to come?
Thank you for having me. So in Africa, the outbreak is evolving differently from what we have seen in other parts of the world. If you look at the situation, we are beginning to see gradual decrease in number of cases, especially in most of the big countries that are contributing more than 90% of the cases on the region. Countries like South Africa, things are stabilizing there. Countries like Nigeria as well. But we still have some few countries that are reporting increasing cases on daily basis. But generally, on the continent, we are seeing that the number of cases are declining.
As the world scrambles to halt the COVID-19 pandemic, there is concern that not enough testing is being done in Africa. Experts say a lack of comprehensive testing across Africa means the true extent of the pandemic is not known. In Tanzania, for instance, the government outlawed COVID-19 testing and declared its national outbreak defeated. In neighboring Kenya, the situation is different, as the government is working closely with WHO to increase the testing capacity. Residents in one of the poor neighborhoods in Kenya's capital, Nairobi, are seen here lining up for the COVID-19 mass testing. What needs to be done to improve the testing capacity of African countries?
What we can do is to make sure that this testing is decentralized to all levels of the health system, from national, regional, district, and even in those communities where it is possible to decentralize this testing so we can test as many as possible. Another thing is for the countries to also look at their testing strategies. Where they have the capacity, they can expand the testing. Most countries in Africa are actually testing suspected cases. They are testing contacts and testing people they put in quarantine.
The COVID-19 pandemic has exposed major weaknesses in health services that require urgent attention in many African countries.
An April report by the United Nations Economic Commission for Africa concluded that healthcare systems across the continent are under-resourced.
This patient in South Africa aptly captures the sorry state of health facilities in the continent.
Sick people are getting sicker. Some are dying on their legs, you know. It's hurting. It's hurting really.
Now, Dr. Mary Stephen, what are the challenges faced by healthcare systems in Africa when dealing with COVID-19, and how should they be addressed?
Basically, the availability and accessibility to other routine health services is what we are seeing that is being affected for two reasons. One, there is a lot of focus on the COVID response. Secondly, people are afraid of going to the hospitals for the fear of COVID to access their routine health services. So these are two major reasons we are seeing with regards to the continuity of essential services, and most countries are working on this. But with regards to generally the COVID response, countries in Africa, including South Africa, have been able to manage the cases well, and they managed to admit everyone that requires admission. So basically, they were able to cope. And this is partly because the severe cases we are seeing in Africa is not as much as what the other parts of the world have experienced.
While the COVID-19 pandemic has exposed weak healthcare systems in Africa, some countries in the continent have taken innovative action to strengthen their health systems. Rwanda has, for instance, deployed robots in the fight against COVID-19. The robots are the result of joint efforts by the Rwandan Ministry of ICT and Innovation and the United Nations Development Program. The country's health minister explains here.
I think they will help, especially health professionals who are here in taking some of their duties and therefore being less exposed to be infected by COVID patients who are here. There is a lot to do here in a treatment center, because you need to provide drugs, you need to collect vital signs, you need to provide food, meals, etc.
How can African countries turn the COVID-19 threat into an opportunity to improve the continent's health sector?
African countries can use the opportunity of the COVID outbreak to build back better their health system. This is what we do even in response to other outbreaks. Whenever you have an outbreak, there is an opportunity to build on existing system so that when the outbreak is over, your system would have been left in a better place than when you started. And when these capacities are built, you can also use them to respond to outbreaks in the future.
In a sad turn of events, as Africa COVID-19 infections passed the 1 million mark, there have been allegations of corruption involving personal protective equipment.
Massive corruption scandals have been reported in Zimbabwe, Kenya, and South Africa.
In Kenya, President Uhuru Kenyatta called for speedy investigations following an expose on corruption at the country's top medical supplies body.
I want to once again reiterate that all persons found to be prima facie culpable as a result of those ongoing investigations should be brought to book, notwithstanding their public office or their political, and for that matter, their social status.
The World Health Organization Director Dr. Tedros Adhanom did not mince his words in condemning COVID-19 related corruption.
Corruption related to PPE, life-saving, for me, it's actually a murder. Because if health workers work without PPE, we're risking their lives. And that also risks the lives of the people they serve.
Welcome to this part of the program where we get to read what you, our viewers, had for us this week. On our coverage of agricultural discrimination on women, we had at Devanji stating, Linda Masarira is going to be practicing Fumvudza this coming farming season to utilize a small space and harvest huge. We also had at Awan Africa stating, if Africa is to ensure food security post-COVID-19, youth agribusiness and agriculture will be vital. We also had Julius Chemo stating, agriculture is effective in reducing poverty in Africa. We should take it serious. We also had at Pravin stating, farming is a profession of hope. You cannot separate women from that. We also had Market Woman saying, women do it all. We also had Agricultural Post stating, the earth depends on the earth tillers who put smiles on the faces of its inhabitants. Well, that's all for now. We appreciate all your feedback. Thanks for staying tuned. Keep the comments coming. Very strong remarks there by the WHO Director General on the urgent need to end COVID-19 related corruption.
Well, that brings us to the end of our show today. We're looking forward to your comments on what you have seen in our show today and suggestions on topics you would like to see covered here at Africa Today.
You can also send us images of interesting events happening in your country so that we share them with other viewers across the continent.
And thanks for staying tuned, and goodbye from me, Mubarak Kenya.
And on behalf of the entire Africa Today crew, it's goodbye from me, Sheila Nelima. Take care and God bless.